This time looking at sternocleidomastoid. So sternocleidomastoid comes into the front, the anterior part of the throat, the neck area. So there's the sternal section, and then there will be the clavicular section. Sternocleidomastoid, sternal section, and then the clavicular section. Because of the weight of the head, all we need Mayumi to do now is just lift the head off the table. And as soon as she does that, you can see the muscles, sternal section, clavicular section, have a rest. Anytime you're looking for these muscles, don't have people holding their head for long periods of time, it will collapse. So this time, when Mayumi lifts up, sternal section, she will turn towards this side, and then you will see there's the clavicular section and there's the sternal section. So it will do flexion, and it will do rotation, and it will do lateral flexion of the cervical vertebrae. If, whilst we're there, we're then looking for scalene, scalene. So we look for the triangle between sternocleidomastoid, the upper trapezius, and the clavicle. So once you've located that, then you can push your finger towards the vertebral column. Just make sure there's no pain involved doing that. Your hand goes by the side of the head. And what Mayumi will do in a sec is to bring the ear down towards the shoulder on the same side. Go ahead. And the part that just jumps up there is scalene, scalene. So you need to be careful here because of the brachial plexus. Another way of locating that is to keep your fingers into the same place, and then just get Mayumi now to take a nice deep breath. And there they are again, because they lift up the ribs. There's an anterior, there's a middle, and there's a posterior scalene, scalene. And they will do lateral flexion. Some of the anterior part will do flexion, lateral flexion, and they will elevate the ribs as well. This time what we're going to do is look at the separation between pectoralis major, the clavicular section, which obviously comes from the clavicle and comes across to the humerus, and then the sternal section, the big sternal section which comes from the sternum and the ribs, again across to the humerus. So in this particular case, if we get Mayumi to lift the arm up, she's going to give me the thumbs down, so that's medial rotation, fingers into the corner just there. What I'm going to try and do is to just try and pull the arm away from the ear. And this time Mayumi is going to stop me from doing that. So just hold your arm there for me, and just hold it there. Pectoralis major, the clavicular section, so we just come in and try to elongate the muscle, bring the 2 points further apart. And in this particular case, Mayumi is going to try and bring it across her face. Pectoralis major, so we have a clavicular section, comes from the clavicle and goes on to the humerus. Pectoralis major clavicular, and then for the external section, because we're dealing with female, they spread their fingers, you put your fingers on top of their fingers, and in this particular case, what I'm going to try and do is to take the arm out in the different directions. So this time we're going up and out. What Mayumi is going to do is to try and bring her hand towards the hip on the opposite side. And then you'll probably be able to see, and certainly you'll be able to feel the muscle mass jump up and hit your fingers. Clavicular section, the hand up into there. Arm position, thumb position is exactly the same. I'm just going to try and pull the arm down. This time Mayumi is going to stop me from doing that. And you can probably see the muscle just jump up. And then this time the hand comes a little bit further down, your fingers on top of their fingers, and then from here, this time, that's the direction that I'm going up and out. From there, this time, stop me, and so Mayumi is trying to bring this arm across towards the hip on the opposite side. Pectoralis major. If you need to do both sections, from there, then Mayumi is just going to bring the arm straight across the chest. Okay, go ahead and just do that for me. So that will activate both the clavicular and the sternal section just by bringing the arm across the chest. Pectoralis major. And we have a sternal section. Comes from the sternum and also attaches to the ribs as well, and comes across onto the humerus as well. Pectoralis major clavicular, pectoralis major sternal. Adduction. So will they bring the arms together? Flexion at the shoulder. They will assist in doing flexion at the shoulder. pectoralis major clavicular, pectoralis major sternum. This time we're going to locate the serratus anterior, and for people that have a tight fitting garment, there's a line that comes down the centre. That's what they call the mid-lateral line. And then just go anterior to that and press fairly firm, and all that we need Mayumi to do now is to try and touch the ceiling. Abduction of the scapula, and again, up. Abduction of the scapula, serratus anterior. So in order to locate that, find the tight-fitting garment, the seam down the centre, just come anterior to that. They try and touch the ceiling, so they're actually moving the scapula. The arm is not moving, it's the scapula that's moving to bring the medial border of the scapula further away from the vertebral column. Abduction of the scapula. Serratus anterior. Serratus anterior is the jagged edge, serrated edge. Goes all the way up to rib 1, wraps around the ribs and attaches onto the anterior surface of the scapula, the medial border. Serratus anterior. Same muscle there, goes right up to rib 1, wraps around the ribs, so it comes between the ribs and the anterior surface of the scapula onto the medial border. Its primary function is abduction of the scapula. Abduction of the scapula. Serratus anterior. And then from there, pectoralis minor. In this particular case, what Mayumi is going to do is just lift the arm just off the table. That will activate pectoralis major. So once we can locate that, the hand goes underneath. Just be careful of people that might be ticklish. The hand at the back, so that the heel of your hand is dropped onto the table. The fingers are going over the top of the chest, they're not digging into the chest. Lift, push up, lift, push up. So you're trying to get all the way underneath pectoralis major. When you think you're in position, this hand is going to let go. Mayumi is just going to try and keep that in place. And then, so she's actually done protraction, and that will find pectoralis minor. From there again, the arm is out to the side. They lift the arm very gently off the table, which activates pectoralis major. Hand in place, arm goes down, lift, push. Now just make sure that they're not lifting, because if they lift, they'll activate lots of other muscles as well. Then curl your fingers down to press against the ribs. This hand is taken away. They just hold the shoulder where it is. And that's pectoralis minor. Protraction of the scapula is its primary function. Serratus anterior, underneath pectoralis major is pectoralis minor. In this diagram, pectoralis major has been cut away, both the clavicular and the sternal sections, to expose pectoralis minor. Pectoralis minor comes and goes to ribs 3, 4 and 5. So there are 3 muscles that attach to the coracoid process: pectoralis minor, coracobrachialis, and the short head of the biceps. Pectoralis minor will do protraction. It will roll the scapula forward. Pectoralis minor. External oblique. So external oblique, arm goes across the chest and the torso, fingers to the front of the waist area, and all that Mayumi is going to do is very gently just sit up, to just very slide that hand very slowly. That's enough, enough. And that's external oblique. So first of all, put the arm across the chest, across the torso, fingers into the front, the anterior part of the waist area. Mayumi will just sit up as if she's doing a sit-up with a twist, and that's external oblique. External oblique, external, towards the outside, oblique, at an angle. They interdigitate with the serratus muscles, and so attach onto the ribs, and then they come down onto the ilium. External oblique. So if the shoulder on this side were to come forward, then they would bring these 2 points closer together. Anterior rotation of the torso. For rectus abdominis, either side navel area. And again, all that Mayumi is going to do from there is to bring the chin to the chest and then lift the shoulders off the table to do a curl. Rectus abdominis. Either side, abdominal area, either side of the navel, chin to chest, then shoulders come up. Rectus abdominis. Rectus abdominis. Rectus abdominis actually comes quite high, almost level with the nipple area, and then comes down onto the pubis, the pubic crest. Rectus abdominis. Flexion, particularly the lumbar vertebrae. Flexion, lumbar vertebrae. This time for the psoas muscle. So we find the anterior superior iliac spine. And then we go for the lateral border of rectus abdominis, and we're heading towards the vertebral column. Once you can do that, and getting fairly deep, but be careful it doesn't hurt, then all that we have to do from there is get the person to just go up onto their toes, and just lift the heel off the table, as if they're bringing the knee towards their chest. It has to be very, very gentle, because it can be really painful. Hip flexion is one of the actions that this particular muscle does. Anterior superior iliac spine, lateral border of rectus abdominis. Your fingers are going towards the vertebral column, so they're going diagonally in, and then all they have to do is very gently heel off the table. Deep inside the abdominal cavity, this is the vertebral column, looking at it from the front. This is psoas, and psoas comes from the lumbar area and comes down onto the femur, the lesser trochanter of the femur. Psoas muscle. Considered to be very heavily involved in soft tissue damage, low back. Psoas. Very often, anatomy books call it the iliopsoas. This time, psoas from a different angle, anterior superior iliac spine, the spike bit at the front, the lateral border of rectus abdominis, diagonally going in. Just be careful, this can be painful. And all that they have to do really gently, just bring the knee up, so lift the heel off, and that's sufficient. That should be really easy to locate psoas, so long as you go in deep enough without hurting. Anterior superior iliac spine, diagonally in towards the vertebral column. They just bring their thigh very gently and only just towards their chest. So it's not a vicious movement, it's not a long range of movement. What it needs is just a little bit of action. Psoas, flexion at the hip, flexion at the lumbar vertebrae. Sometimes there is a psoas minor, and sometimes there's not. Sometimes it's on one side, so there's variations here. Psoas. Major iliacus.